Hi, welcome back to my channel. In this video, I will be discussing about the sequence and timing of cleft lip and palate surgery. So this is like a very important topic for INSET exams, and it is most commonly asked question too. So after this video, hopefully you will be able to attempt it nicely. So first of all, the first surgery that the first problem that we tackle is of the cleft lip. Now the timing is 3 months. Alright, now in this we basically follow the Millard's rule of 10. So according to it, we have to have the age more than 10 weeks of age, then more than 10 gram per deciliter hemoglobin, then more than 10 pounds of weight. And now see, this is the Millard's rule, and now extra thing has been added now, which is that the WBC count should be more than 10,000 per cubic millimeter. Then yeah, now why do we need to wait till 3 months? Like we can see the cleft lip right in the birth at the birth. So why do we wait for 3 months? So this is basically because the scar is better after some growth, and landmarks are well defined. Alright, then coming on to the second surgery. Now the second surgery is of palate. Now this is important. We do it from 9 months to 18 months. Now here there are two implications that you should be aware of, that if you do a early surgery and if you do a late surgery. If you do a early surgery, it will restrict the maxillary growth, and if you do the late surgery, it will basically impair speech. Alright, then the third surgery, that timing is for the velopharyngeal incompetence. Now this is for speech. Now this is done at 3 to 5 years of age of the child, and this is for the basically this is for speech correction. Alright, then coming on to the fourth one. Now after you've done this, you will now tackle the alveolar cleft. So this is basically alveolar cleft bone grafting. Now this is basically done in the mixed dentition and mixed dentition phase, and it is done before the eruption of canines. So this is done at an age of 6 to 9 years. So 6 to 9 years. Now in this, what you do is you give bone graft for arch continuity, and you also do palatal fistula repair. Now the next surgery is the one which you do in the adult age. So adult surgery. Now this is basically in girls it's done at 14 to 16 years, and in males it's done at 16 to 18 years. This is because of the difference in the pubertal spurts of male and female. And in this, what all surgeries do you do is orthognathic surgery, then you do cleft rhinoplasty, and you can also do lip revision surgery. Now sometimes we get a question, and like it has options, like for example we can repair the cleft lip plus soft palate at the age of 3 to 5 months, and the hard palate at 9 to 18 months. Alright, so and sometimes you can get a thing where you are repairing the cleft lip and alveolus at 3 to 5 months, and you are correcting the cleft palate at 9 to 18 months. And then there can be an option in which you are basically repairing the cleft lip in 3 to 5 months of age, but you are like repairing the cleft of hard and soft palate in 9 to 18 months. So all of them are correct. it depends upon the protocol that is being followed in the institution. So basically just follow through this table, and this will basically get all the questions that are asked from this topic. So if you found this video helpful, do give it a like, share, subscribe, and you can comment too. Thanks for watching.